So you're looking for data on healthcare in the United States. We can help. The collection of healthcare statistics has actually been kind of important for quite a while, at least going back into the 1850s with, for example, Snow's cholera map, in which he was able to use the location of deaths by cholera around a particular well in London to link cholera as a waterborne illness. The Florence Nightingale data, in which she collected causes of death in the hospitals in which she was a nurse and an administrator, showing that the cause of death from being wounded in action was relatively low. It was actually post-operative infections that were causing the majority of the deaths. In 1870, the Census Bureau was collecting these kinds of data, epidemiological data, with, for example, the map that we published in the 1870 Census Atlas on the deaths through malarial disease. And there was also this chart on deaths by specific causes in specific states within different age groups. There were many different kinds of death statistics which we were collecting at that time. Now, in the 20th century, other agencies of the federal government as well as the states have come in to collect these kinds of epidemiological statistics. For example, this incidence of Rocky Mountain spotted fever and case fatality data that go back to 1920 from the Centers for Disease Control. Now, the Census Bureau still collects a great deal of data that are important for health statistics and the understanding of the provision of health care, in particular about health care access. For example, in the current population survey, we collect data on the rates of health insurance coverage on a national level, broken down by some particular groups. You see here the number of uninsured and the uninsurance rate from 1987 through 2011. Numbers in millions, rates in percent. These kinds of data can give us a national picture of what's going on. If you're interested in smaller geographies, we have the American Community Survey, as well as the Small Area Health Insurance Estimates Program. Both of these provide health insurance coverage rates on smaller geographies. The American Community Survey can go down to the block group level, for example. Are you living in an area where there are doctors and nurses who can treat you? Using the data from our County Business Patterns program, we can create a map showing where the doctor's offices are in the United States and then relate those to population figures to produce the number of people per doctor's office by county. The question of people per doctor's offices actually raises an important point. A lot of the data that the Census Bureau collects is useful and informative of healthcare services. The size of the population, the size of the elderly population, male, female, race, Hispanic origin. A lot of what we collect is actually predictive of different kinds of ailments and different kinds of requirements for medical care. The work that other agencies are doing in modeling where we're going to need hospitals and where we're going to need medical services provided in the future, a lot of it comes from the Census Bureau data. We've got data on other things too. We've got all kinds of surveys. The Survey of Income Program participation, for example, has a question on how many times you've been to a doctor's office in the last year, your basic state of health. We have surveys about all kinds of stuff. We've talked about some of the basics here, and you can find more on this website.